Welcome to LPN LaunchPad's review of fall risk and prevention. This session will highlight why falls are a critical concern and provide strategies for identifying and reducing their occurrence in healthcare settings. Falls are the leading cause of hospital acquired injuries, with an exceptionally high incidence in older adults, often resulting in serious complications like fractures, head injuries, and prolonged hospital stays. Focusing on fall prevention is important. Intrinsic risk factors include a history of previous falls, the strongest predictor, being age 65 or older, muscle weakness or impaired mobility, cognitive impairment such as dementia or confusion, medications affecting balance, sedatives, opioids, diuretics, antihypertensives, urinary urgency or incontinence, and dizziness or orthostatic hypotension. Extrinsic risk factors include environmental elements like cluttered rooms, wet or slippery floors, inadequate or missing lighting, especially nightlights, improper use of assistive devices, and reliance on unstable furniture for support. NCLEX tip: fall risk. Nocturia and edema may signal heart failure. A history of falls is the single highest risk factor for future falls, and multiple medications increase the potential for falls. Fall risk tools help identify high risk patients early. Standard tools include the Morse Fall Scale MFS, the Johns Hopkins Fall Risk Assessment, and the Hendrick II Fall Risk Model. The Morse Fall Scale MFS is a quick, acute, and long term care screening tool. It evaluates whether there is a history of falls, 25 points, secondary diagnoses, 15 points, the type of ambulatory aid used, 0 to 30 points, the presence of an IV or heparin lock, 20 points, the gait pattern, 0 to 20 points, and mental status, 0 to 15 points. Interpreting the Morse Fall scale involves these categories. 0 to 24 means no risk and only standard precautions. 25 to 50 indicates low risk requiring fall prevention measures, and scores over 50 mean high risks requiring strict fall prevention. Remember that a history of falls is the strongest predictor of future falls. Slide 9. The Johns Hopkins Fall. Risk assessment is a comprehensive tool used in hospitals and rehab settings. It scores factors like age, fall history, medications, patient care equipment, mobility, and cognition to establish a fall risk level. The Johns Hopkins Fall Risk Interpretation typically sets 0 to 5 as low risk, basic prevention, 6 to 13 as moderate risk, enhanced precautions, and 14 or higher as high risk, strict measures. NCLEX tip: patients with dementia or confusion often have high scores. The Hendrick II Fall Risk Model focuses on older adults, looking at confusion or disorientation, 4 points depression, 2 altered elimination, 1 dizziness or vertigo, 1 male gender, 1 anti-epileptics or sedatives, 2 and a get up and test scored from 0 to 4. Interpreting Hendrick II involves scores of 0 to 4 as low risk with basic precautions, whereas 5 or more indicates high risk needing intensified interventions. NCLEX tip: the get up and go test is key for assessing mobility. Fall prevention strategies matter because they reduce complications, shorten hospital stays, and improve outcomes. Interventions should match whether the patient is low, moderate, or high risk. General fall prevention measures for the environment include keeping floors dry and clutter free, providing adequate lighting and nightlights, placing call lights and personal items within reach, keeping the bed in its lowest position, and locking bed wheels for stability. Additional measures include encouraging prompt use of the call light, responding quickly to requests, providing non slip footwear like socks or shoes, ensuring canes or walkers are adjusted to the correct height, and supervising patients to confirm the safe use of assistive devices. High risk fall prevention strategies often involve placing fall risk signage on doors and at the bedside, using bed or chair alarms for patients at most significant risk or those who are confused, and considering one on one observation for extremely high risk individuals. Scheduled safety rounds, such as hourly rounds, help address pain, positioning, and toileting needs. At the same time, a thorough medication review focuses on drugs such as sedatives, diuretics, opioids, or antihypertensives that might worsen instability. Patients should be reminded to change positions slowly. NCLEX tip, high risk strategies, emphasizes that bed alarms and regular rounding substantially reduce fall rates, and a frequent toileting schedule helps prevent patients from rushing independently. Patient education covers asking for help before getting up, demonstrating proper technique for walkers or canes, and underlining the importance of remaining cautious while ambulating, especially if the patient is dizzy. It's also crucial to explain medication side effects. Some medications cause lightheadedness or dizziness. Also, share home safety tips, such as removing rugs, decluttering walkways, and installing grab bars or stair rails if needed. Key takeaways for assessment tools. The Morse Fall scale classifies scores above 50 as high risk. The Johns Hopkins scale uses 14 as the threshold for high risk, and Hendrick II sets 5 or higher as high risk, especially in older adults. Key prevention strategies include keeping the bed low, ensuring the call light is within reach, providing non slip footwear, scheduling frequent toileting and rounding, and reviewing medications for drugs that might promote falls. The final summary underscores the importance of using established risk assessment tools, Morse, Johns Hopkins, and Hendrick II, implementing general and high risk prevention measures, and thoroughly educating patients on environmental and personal safety. NCLEX study. Tips. Fall risk assessment highlights that a documented history of falls is the strongest predictor of future falls. Multiple medications raise the risk, and combining bed alarms with frequent checks is vital for confused patients. NCLEX study tips. Fall risk assessment tools reinforces that a Morse score over 50, a Johns Hopkins score of 14 or more, and a Hendrick II score of 5 or above signify high fall risk. NCLEX study tips. Fall prevention emphasizes a bed in the lowest position with locked wheels, call lights within easy reach, non-slip footwear, scheduled toileting, and correct use of assistive devices. NCLEX study. Tips. Environmental safety suggests removing clutter, keeping floors dry, using sufficient lighting and night lights, and ensuring that assistive devices are well maintained, properly adjusted, and always within reach. NCLEX study tips. High risk patient interventions focuses on bedside fall risk signage, ongoing medication reviews, slowing position changes to avoid orthostatic hypotension, and employing bed alarms, plus hourly rounds for confused patients. NCLEX practice. Question 1. Which factor is the strongest predictor of future falls in a hospitalized patient? A. Age over 65. B. History of falls. C. Diagnosis of dementia. D. Use of diuretics. The correct answer is B. History of falls. Previous falls are the strongest indicator of future fall risk. Although other factors matter, none surpass a documented history. NCLEX practice. Question 2. A patient with a Morse fall scale score of 55 is classified as A. No fall risk. B. Low fall risk. C. Moderate fall risk. D. High fall risk. The correct answer is D. High fall risk. According to the Morse fall scale, a score exceeding 50 calls for strict fall prevention measures. NCLEX practice. Question 3. Which intervention is most appropriate for a patient with a high fall risk due to confusion and frequent attempts to get out of bed unassisted? A. Raise all four side rails. B. Place a bed alarm and perform hourly rounds. C. Restrict fluid intake to reduce bathroom trips. D. Instruct the patient to call the nurse only if they feel dizzy. The answer is B. Place a bed alarm and perform hourly rounds. This combination prevents unassisted exits and is safer than raising all side rails or limiting fluids while providing proactive support. Hey there. This is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.